multi-million-dollar oxygen plant has been unveiled at the St. Anne's Bay Regional Hospital, marking a significant step by the Health Ministry to diversify the supply of medical-grade oxygen. The new facility will be fully owned and operated by the government. Crosskill reports.
The shared trauma the nation experienced as a result of the COVID-19 pandemic takes on added perspective when viewed from the experiences of the Minister of Health, Dr. Christopher Tufton, who described just how close the island came to untold disaster.
We came that close. One of my most scariest moments during the COVID pandemic, and there have been a few, but one that really remains memorable to me was that night into early morning when we were racing against time to unload and to deliver medical oxygen. It drove the point home to me how critical this particular support infrastructure was for patients who suffer lung-related ailments, which COVID was a very big manifestation of.
Recognizing the risks associated with relying on a single supplier of the critical gas, plans to expand the supply of medical oxygen were announced in 2021. That ambition has been fulfilled in part as the St. Anne's Bay Hospital unveiled the first oxygen plant of its kind in the public health sector, capable of producing 30 litres of medical oxygen per minute at peak flow.
It is not the best strategy or indeed policy to over-concentrate and to overly depend on one source to supply you with a life-saving input, such as medical oxygen, for an entire public health system. It's not by design, as fate would have it, and as the commercial world would have it with consolidations and so on. We have one supplier of this product, or certainly back then, not anymore. It is an essential stage or step towards resilience. It reaffirms the commitments that have been made by the government, by the ministry. It supports the partnership that has remained strong and will only strengthen given the importance of what we're doing here and will do in Maypen. And ultimately and critically, it is benefiting and will benefit the people of Jamaica, which is really what it's about. That's why we are here. We are here to serve those who need this type of service.
The occasion was made possible due to the shared efforts of UNICEF and the people of Canada, who were represented at the handover ceremony of the $125 million facility by the Canadian High Commission's Head of Cooperation, Mr. Sheriyar Savar.
It is an honor to be here today on behalf of the Government of Canada. Today, we acknowledge a significant achievement coming out of our partnership with the Government of Jamaica and with UNICEF, the handover of the first government-run oxygen plant in Jamaica.
Crosskill, CVM News.